Today we're going to talk about some spinal nerves and do a quick little anatomy review on the spine. I've seen a ton of patients recently come in with numbness, tingling in different parts of their arms and their legs. So just giving you an insight on what I look for as a practitioner when someone comes in and how we can figure out where the issue is and how we can fix it. So here we're looking at a spine. Up top here, we can see in the purple, that's your cervical spine, that's up in your neck. This green portion is your thoracic spine, which is your mid-back, and then this kind of bluish purple is your lumbar spine and your low back. The big things we're talking about today are your nerve roots. So they pop out between your vertebral bodies, and they all have a different function. They all go to different places, so we can kind of track back, depending on what your symptoms are, and figure out where it's being affected. Now let's see what it looks like on a patient. So here, looking at the spine, we can see these bumps that go down the back. Those are called your spinous processes. So you can feel them on yourself, just feeling right down the back of your spine. When you come in and we adjust you or we feel the motion in your spine, those joints live right about here, all the way down. Here you can see me doing an exam on Denise, starting with her upper extremity, checking her muscles as we go down through her arms, checking the different nerve roots that innervate these muscles, and then moving on to sensation. So checking different points along her arm and her hands to see if she notices more or less sensation. And then finally, checking the reflexes. Next, we'll check her lower extremity, so the nerve roots that come out in her lumbar spine. We'll do some muscle tests, we'll check her reflexes, and we'll go along and do some sensation as well. If you're experiencing any numbness or tingling or weakness going on, come on in and we can give you a full eval and figure out what's going on.